Did you know that nearly 40% of Americans may be deficient in vitamin B12 without even realizing it? This condition can lead to nerve damage, depression, and cognitive decline. Watch this video now to learn how to identify and address the issue before it's too late. Did you know that millions of Americans are facing vitamin B12 deficiency without even realizing it? This is not a rare issue. Research shows that around 6% of adults under 60 and up to 20% of those over 60 in the US are deficient in this essential nutrient. The concerning part is that this condition can lead to serious health consequences, ranging from fatigue and memory decline to permanent nerve damage. Sounds worrying, doesn't it? But before we dive into how to prevent it, let's take a closer look at what vitamin B12 really is and why it plays such a crucial role in our health. What is vitamin B12 and why is it important? Vitamin B12 is an essential nutrient that the body cannot produce on its own, but it plays a crucial role in many biological functions. It is a key component in the production of red blood cells, helping to prevent anemia and ensuring effective oxygen transport throughout the body. In addition, vitamin B12 supports the nervous system, maintaining brain function and central nervous system health, while also playing a role in energy metabolism and DNA synthesis, key factors for cell growth and repair. The primary sources of vitamin B12 come from animal-based foods such as red meat, fish, eggs, and dairy products. For those who follow vegetarian or vegan diets, B12 can be supplemented through fortified foods such as cereals, plant-based milk, and nutritional supplements. Ensuring adequate B12 intake in the diet is essential for maintaining overall health and preventing complications caused by deficiency. Although vitamin B12 is present in many foods, more and more Americans are becoming deficient without even realizing it. Could this be due to diet, age, or some other factor? Let's break down the main causes right now. What causes B12 deficiency in Americans? Vitamin B12 deficiency is becoming increasingly common among Americans, and the primary causes stem from diet, digestive issues, age, and the impact of certain medications. One of the leading causes is changes in dietary habits. With the rise of vegetarian and vegan diets, many Americans no longer consume enough animal-based foods, the richest natural sources of B12. Since vitamin B12 is almost absent in plant-based foods, individuals following these diets are at greater risk of deficiency unless they supplement properly. In addition, the ability to absorb B12 is affected by digestive issues. Those with gastrointestinal conditions such as ulcerative colitis or Crohn's disease often struggle to absorb nutrients, including B12. Furthermore, individuals who have undergone stomach surgeries, such as partial stomach removal or weight loss surgery, are also at higher risk due to structural changes in the digestive system that impair the absorption of this vitamin. Age also plays a significant role in B12 deficiency. As the body ages, the ability to absorb vitamin B12 from natural food sources declines significantly. Older adults, particularly those over 60, are at greater risk due to decreased stomach acid production, which reduces the ability to extract B12 from food. Additionally, those with pernicious anemia or autoimmune disorders may have difficulty absorbing this vitamin. Finally, the impact of certain medications can contribute to deficiency. For instance, metformin, a commonly used medication for treating type 2 diabetes, has been shown to lower B12 levels in the body. Similarly, acid-reducing medications used to treat acid reflux or stomach ulcers can impair B12 absorption by reducing the acid needed to release the vitamin from food. All these factors contribute to the rising rate of B12 deficiency among Americans, putting many at risk for serious health issues if not detected and addressed promptly. Vitamin B12 deficiency is not an issue that happens immediately. It silently affects the body over time. You might not see it with the naked eye, but your body will definitely feel it. So, what signs indicate that you might be lacking this essential vitamin? Symptoms of vitamin B12 deficiency. Vitamin B12 deficiency can lead to a range of symptoms affecting both physical and mental health, varying from mild to severe. Therefore, early detection of these signs is crucial for timely intervention. In the early stages, the symptoms are often vague and can be easily mistaken for other health issues. Those with B12 deficiency may experience prolonged fatigue, dizziness, pale skin due to anemia, and difficulty concentrating. These signs are often overlooked or attributed to stress, lack of sleep, or poor diet. If the deficiency persists, neurological problems may arise. Affected individuals might experience tingling or numbness in their hands and feet, loss of sensation or balance, and memory decline. These symptoms occur because vitamin B12 plays a key role in maintaining the myelin sheath that protects nerves. When B12 is lacking, nerves can become damaged, leading to discomfort and long-term risks. In severe cases, B12 deficiency can cause depression, mood swings, and permanent nerve damage if left untreated. Studies have shown that B12 is closely linked to mental health, and prolonged deficiency can increase the risk of psychological disorders and even affect cognitive function. Therefore, if you or a loved one are experiencing any of these signs, especially in older adults or those at high risk, it is essential to check B12 levels and supplement it promptly to protect long-term health. The symptoms of B12 deficiency can silently erode your health. Many of you might be wondering if you're deficient in B12. The only way to know for sure is to get tested. Let's explore how to check and effectively treat this deficiency right now. How to test for and treat B12 deficiency. Testing and treating vitamin B12 deficiency play a crucial role in maintaining health and preventing long-term complications. If you suspect you are deficient in B12, the best approach is to undergo tests to accurately determine the deficiency level. The most common test is a blood test that measures B12 levels, helping to identify the amount of this vitamin in the body. However, in some cases, this test might not accurately reflect the deficiency, as B12 levels in the blood can still fall within normal limits, even if the cells aren't receiving enough. To get a more detailed assessment, doctors may request tests for homocysteine and methylmalonic acid. When B12 is deficient, the levels of homocysteine and MMA in the blood are often elevated, helping to detect the deficiency earlier, even when the basic B12 test doesn't provide clear results. If diagnosed with a deficiency, timely supplementation is necessary. Those who can absorb the vitamin through the digestive system can increase their intake through natural foods like meat, fish, eggs, and dairy, or fortified foods like cereals and B12 supplements. For individuals with absorption issues, such as the elderly, those with digestive diseases, or those who have had stomach surgery, B12 injections or high-dose oral medication are more effective options. Regular testing and proper supplementation will help prevent severe complications from B12 deficiency, ensuring overall health and maintaining stable nerve function. If you're at high risk, don't hesitate to consult with a doctor for appropriate guidance. Treating B12 deficiency is important, but why wait until your body signals the problem? Prevention is always the key to protecting long-term health. Let's explore some simple yet effective ways to prevent B12 deficiency, starting today. Preventing vitamin B12 deficiency is the best way to protect long-term health, especially for high-risk groups. Fortunately, there are many simple yet effective measures to ensure your body always receives the necessary amount of B12. First, maintaining a balanced diet with B12-rich foods is the most natural and effective prevention method. Foods such as meat, Fish, eggs, dairy, and dairy products are abundant sources of vitamin B12. For those with a flexible diet, regularly including these foods can help maintain stable B12 levels. However, for vegetarians or vegans, B12 deficiency poses a significant risk since this vitamin is primarily found in animal products. To ensure adequate B12 intake, they can consume fortified foods such as breakfast cereals, B12-enriched plant-based milk, or ideally, take B12 supplements as recommended by a doctor. In addition, regular health checkups are crucial, especially for the elderly or those at high risk, such as diabetes patients, individuals with digestive disorders, or those using medications that affect B12 absorption. Regular testing helps detect any declines in B12 levels early, allowing timely adjustments to prevent serious complications. By implementing these preventive measures, you can ensure your body always has enough vitamin B12 to maintain energy, support the nervous system, and protect overall health. Don't wait until symptoms appear. Take proactive steps for your health, starting today. So, we've explored vitamin B12 deficiency, a health issue affecting millions of Americans. We've uncovered the common causes of deficiency, how to recognize the symptoms, and effective ways to check, treat, and prevent it. The most important takeaway is to pay attention to your diet, supplement B12 properly if needed, and schedule regular health checkups, especially if you're in a high-risk group. Have you ever checked your B12 levels? If not, now might be the right time to take proactive care of your health. Leave a comment below and share your thoughts on this topic. If you found this video helpful, don't forget to like, share, and subscribe to the channel so you don't miss out on more valuable health content. Thank you for watching, and we'll see you in the next video.